We're talking about, obviously, the 5-year anniversary of the No Smoking Act and everything that was enacted in Illinois, and specifically here in Quincy. First of all, what has been the overall effect of that over the 5-year time period here in the Quincy, Adams County area?
Well, the great thing is that there is less smoking in public. I'm sure you've noticed, whether it's in restaurants or recreational facilities, things like that, there's less smoking with the ban out in public in the areas such as restaurants and public buildings. However, secondhand smoke is still a huge issue because there's secondhand smoke in the homes. Obviously, people are smoking at home, and those non-smokers who live with them or even just come and visit them in their homes, they're still being susceptible to the secondhand smoke. There is no level of healthy secondhand smoke. All secondhand smoke is, it can cause cancer. And so there's no level that is healthy or safe. It's not one of those things that moderation's okay. Right. Any amount is bad for your health. And it's not just lung cancer. Obviously, it causes cancer, which is the biggest problem. There are over 7,000 chemicals in tobacco smoke, and so out of those 7,000 chemicals, over 250 are known to be harmful, and at least 69 are known to cause cancer. So those numbers really speak to how detrimental to your health it is.
One of the big issues, I would imagine, with the issue of secondhand smoke and the home is children.
Right.
Talk to me about how much a danger this is for children as their bodies are developing and being exposed to secondhand smoke. Talk to me a little bit about that issue.
Okay, yes, the aspect of children is especially, it's near and dear to our heart because these children, they're not smoking, and yet they are still having the negative effects. But even worse, because their lungs are developing, it is known that children who are around smokers, they have more infections, they have more respiratory infections, also asthma. There are so many children with asthma. They say around 1 million children in America have their asthma actually worsened because of secondhand smoke. And again, these children, their bodies are just developing, their lungs are developing, and when they're in a smoke-filled environment, their asthma, their infection, their hospital visits, they're all going to go up. And that's just something that's really not fair for these children who are not making that choice themselves.
What is the key to making change then, since the ban was not designed to address home smoking? People have the freedom to do that.
Right.
But we also have the issue of secondhand smoke and children exposure. What is the key to making change?
Well, obviously the main key is what we would want for you is to stop smoking. That's the best thing. And to, clean as much as you can or get rid of those drapes and those couches and the furniture that has that smoke in there. So the best thing is to quit. And if you want to quit, we have a free program through the Illinois Tobacco Quit Line, 1-866-QUIT-YES, or you can get free nicotine patches. So quitting is the best option. That said, if you live with a smoker or if you are a smoker, if you cannot quit, please smoke outside. Don't smoke around people in a closed location especially, but around people in general. So try and smoke outside. If you are a non-smoker, but you're just trying to protect yourself and your children, go to restaurants that are smoke-free. If you see a smoker, don't walk through that smoke, screen as you go into a building. Also, just making sure that, like I said before, if you have a friend that's a smoker, you can still obviously associate with them, but maybe invite them into your home or go out in public into wide area spaces. Don't be in small enclosed spaces or in their home, which is more likely to be smoke filled. Because the other issue that people don't realize, and there's not as much research yet on this, is third-hand smoke. A lot of people haven't even heard of that. Okay. Not that we need something else to be worried about, but third-hand smoke actually is when there's not even someone smoking at the time, but those carcinogens and those problems are still in, such as the carpet, it's still in the drapes, it's still in your curtains, it's still in your coats. If you are around someone who smokes, but they're not at the time, you're at their house and your child's crawling around on their carpet, your baby can still have third-hand smoke even if no one in the room is smoking. So just things like that to remember.
Okay, you had mentioned carpets and drapes, and I'm like, what's that about? So I was going to ask you about this. I'm glad you went into it. That is third-hand smoke.
That's third-hand smoke. The chemicals, they are still in the drapes, in the carpets. Even if let's say you are cold and you want to borrow someone's coat. If they're a smoker, then their coat has those carcinogens on the coat, and then when you wear it, you can get those on your skin. And the tobacco, those dyes, the things from the tobacco can actually go onto your skin and cause you health problems. So, it's one of those things, just the best thing is for people to quit and to just stay away from it as far as possible.